Hello, everyone, and welcome to Neurona QL. I'm Gyarta Kraya, and I'm thrilled to have you here as we embark on a journey to unlock the extraordinary potential of the human mind and body. At Neurona QL, the mission is to celebrate the power of the brain and inspire each one of you to live a high-quality life. We dive deep into topics that connect neuroscience, mindset, and integrative health practices, aiming to help you harness the strength within to create a life filled with purpose, resilience, and joy. Today, I'm honored to welcome back Dr. Sajjad, an outstanding OBGYN and integrative medicine expert, for the second episode in our series. Dr. Sajjad is known for her approach to treating the body as a whole, mind, body, and spirit. She provides her patients with care that goes beyond just treating symptoms. In this episode, we're focusing on the critical issues of metabolic syndrome. Today, we'll explore how metabolic health is deeply connected to conditions like PCOS, diabetes, and even cancer risks. Dr. Sajjad will share her insights into how lifestyle choices, from sleep and diet to exercise and supplements, play a role in metabolic health. Whether you're personally dealing with these conditions or looking to optimize your well-being, there's so much to take away from her approach. Thank you for joining us, and let's dive into this fascinating conversation about body, mind, and overall health. Hello, today we're here with Dr. Sajjad, continuing our episodes. Hello, Dr. Sajjad, and welcome.
Hi, how are you?
Good. So,
Yeah.
last time we were kind of doing an introduction on everything, and this time we decided to speak on the metabolic syndromes itself. A lot
Mhm.
of people have heard about this, but I want to hear your perspective on it.
Okay, metabolic syndrome is such a common problem these days. Everybody knows about PCOS, right? So PCOS is a metabolic syndrome itself. Yeah. So, the patients are obese, they have, hypertension, they have all sorts of dysfunctions in their body. They cannot, their gut is not working properly. They have hormonal imbalances. And because I'm an OBGYN, so means that also hampers their chances to conceive as well. And that's why most people come to me because they think that I treat infertility. So infertility, yeah, I never give Clomid or letrozole for that purpose because I would like to correct what is the root cause of their problems. And most of the time, it is the metabolic syndrome or PCOS, whatever you word it like. Yeah.
Right. So many women might have the PCOS, right? But you mentioned obesity. What are some other signs and symptoms that are that they might think it might not be PCOS, but only obesity, for example?
No, most commonly obesity is a part of this problem.
Mhm.
If they are just obese and nothing else, then their hormones and everything should be quite in order. Okay. But most of the time, they have issues. Their FSH, LH levels are like kind of reversed. LH is more than FSH. And their estrone, there are, three types of estrogens. It's estradiol, which is the normal. It's estrone, which is kind of metabolism problem of estradiol. Estradiol is not going through the right pathway to be metabolized. So, it is, it's estrone. And it's one is estriol. Estriol is mostly in pregnancy, the levels. Otherwise, it's not really considered. Okay, so if you see, the estrone levels will be higher than estradiol. FSH levels, LH levels, LH FSH ratio will be reversed. LH will be higher than FSH. If you do the hormones at a time like, day 3 hormones, at that time. Otherwise, if you do hormones at particular time of cycles, of course, it will be up and down because sometimes they're pre-ovulatory, sometimes they're anovulatory. And most of the time, these people with metabolic syndrome, uh, they have ovulatory problems also. They don't ovulate. It doesn't mean that they do not ovulate at all. I have seen many people getting pregnant, but this is one issue, which usually they come to the doctor for that.
Right.
Mhm.
So in regards to treating PCOS, it just it involves more than the medications. What do you suggest some of the things that they could do other than start to lose weight?
Okay, so I mean, I think losing weight is,
The big thing, yes, for sure.
yeah, is it? It is very important losing weight, and plus, you have to see, their lifestyle. I first start with their sleep. Okay, what time you sleep? Oh, we sleep at 2 o'clock, 3 o'clock. This is the problem we last time discussed as well. Oh, because why do you sleep late? Oh, my husband comes late. He drives Uber. He drives at night. He comes at 2 o'clock, 3 o'clock. I have to, give him food. And that is the reason some people will say, oh, my kid, 2-year-old, 3-year-old doesn't sleep. Okay, this is the way you have raised your child. If you had, put this child to bed at 8 o'clock or 7 o'clock, this child would develop that habit of sleeping and he will feel sleepy. So that is why. Okay, one thing is sleep. Sleep is very, very important.
Mhm.
And if you don't sleep properly on time, you gain weight. So this is a part, and that, why they're overweight, because they don't sleep. Second thing, they stay on the screens.
Mhm.
This screens, you have this blue light, which is not good. And it affects their brains. It stimulates their brains. They are staying late on the screens, cell phones or whatever they have, mostly cell phones. And, that stimulates their brain and then doesn't, of course, it affects their sleep as well. Okay. Second thing is their eating habits. Eating habits, they're eating junk. People are eating mostly um, carbohydrates, which are like not complex carbohydrates. They will be having like Coca-Cola, Sprite, whatever, sugary drinks, and they have a lot of sugar in it. And that also, these things, and plus, they will all the time they will be eating at McDonald's, Burger Kings, or whatever these fast foods are. These fast foods have really jeopardized the health of our population, people. Now these, you know I mean, chains are now in every country.
Yeah.
So it's not only the problem of United States itself now, it is a problem everywhere. And people think that, in other countries, I'm telling you, they think that, going to McDonald's is kind of a status symbol.
Mhm.
They want to, you know, take somebody to dine out, they will take to McDonald's or Burger King or such places in other countries I'm talking.
It's the
Okay.
fancy place.
Yes. Okay. Even if you see that, people have invited to their house, what they will get? They will get 3, 4 boxes of pizza, right?
Yeah.
And they will, okay, have this pizza. Be my guest. So people eat pizza. They don't know, I mean, how much problematic it will be for their health.
Right.
And believe me, these things are, of course, not good.
Yeah. I think one important thing that I've noticed on food is you have to be aware yourself and you have to ask the question, is the food that I love is loving me back or
Yes,
not? And I think
yes,
that kind of
yes.
switches a lot of the foods that we're actually eating.
Exactly, exactly. And I have seen that if you are, I mean, if you have started eating right, then you do not crave this junk food.
Mhm.
Okay, that's also is this. I mean, diabetics also. If the diabetics stop eating these sugary foods, they do not crave sugars anymore. And of course, this is in their best interest. Yeah, so that's one thing.
So going into the diabetes now, a lot of people think, oh, it's just like the diabetes, but I don't think they know the consequences that comes when it comes to people itself and then to people that are pregnant or trying to become
Mhm.
pregnant. What are some of the risks in the diabetes itself?
Diabetes, it's I think it's one of the most problematic disease. And it is like an epidemic in the world now.
Mhm.
Even in third world countries, I see everybody. In my patient population, I do their when they're pregnant, I do their glucose challenge tests. Believe me, 99% are diabetic, and they're like 22 years old. So you can imagine how, diabetes is the root cause of any disease in the world, you can say, any chronic disease,
Mhm.
any autoimmune disease. Diabetics are very much prone to autoimmune diseases like, lupus, rheumatoid arthritis, scleroderma, you name it, you can have it. Second thing, even with LIGO, you know how bad it looks? Your skin has white patches.
Mhm.
That is also an autoimmune issue. And diabetics are more prone to vitiligo. Secondly, cancer.
Mhm.
You know, cancer, I mean, when I was in residency or in medical school, they will say, okay, diabetics they're more prone to cancers, but they will not tell why.
Right.
Why diabetics are more prone to cancer? Why? Because they have more sugar in their blood, more glucose in their blood, and the glucose feeds cancer. So diabetes itself is a metabolic dysfunction, right? So metabolic dysfunction itself can cause, of course, dysfunction of any cell in the body, and it can convert it to the root of cancer.
Mhm.
And if you have more glucose in your body, then that's a party for the cancer cells because they will party on that sugar and they will grow and grow and grow. So that's what it is. So to make it simple, to make people understand that why we tell them to control their sugar levels, because it will not even control their diabetes and their health and other diseases also. They will, of course, it will protect them from other diseases lifelong. Mhm.
So if someone has tried, for example, with food, has tried all kinds of diet, but it's still high there, would you suggest any medications to start them or injections, or how would you do it?
Okay, so diabetes in older people, okay? There are two types of diabetes. One is the type 1 diabetes, and the other is type 2 diabetes. Type 1 diabetes means that their body is not making any insulin. I think that also is because there was some autoimmune issue which destroyed their beta cells of the pancreas, which secrete insulin. Okay. Now, type 2 diabetes means you have lot of insulin in your body. And pancreas thinks that the body needs insulin because the glucose is high, but it doesn't know that so it keeps on making more and more insulin. But the problem with type 2 diabetics is that their body is not able to utilize that glucose. So pancreas keep on producing insulin, and insulin is not working. That type 2 diabetics are resistant to insulin. So their treatment is a couple of things. Reduce weight. That will increase your insulin sensitivity. That is one thing. Second thing, okay, you reduced weight and still you are diabetic, whatever. Of course, you have to take care of your food. Eat complex carbohydrates, portion of proteins, portion of fats, and inflammation in your body. Take care of that. If your body is inflamed, please take care of the inflammation. Okay, now the insulin cannot enter the cells. Now you have to make this insulin get into the cells. So, in my opinion, the doctor said, oh, your diabetes is not getting controlled. You have to go on insulin. Okay. They already have so much insulin in their body. Please do not give them more insulin. Give them insulin sensitizing agents. They are like, of course, metformin, everybody knows. Metformin is a medication, but I think it sensitizes the body to insulin. It makes the cells, it makes insulin get into the cell and work. Okay. Now, metformin does two bad things. It depletes the body of enzyme CoQ10, which is very important for the body. It's an anti-inflammatory. It is good for your muscles. It's good for your energy. And second thing is vitamin B12. So if you are giving metformin, you should be giving them CoQ10 and B12. So instead of giving B12, I give them B complex, because not just B12, they are lacking other Bs also, right? So it's good to give them B12. Second thing is that, of course, there is cinnamon. Cinnamon is a spice, which is much used in some cultures. Uh, and chromium. Chromium is another thing which also sensitizes. So I give them like cinnamon capsules. I give them chromium to sensitize the body to insulin. They make the insulin enter the cells, and then it takes care of their diabetes.
Okay.
So,
Is
yeah.
there anything related with cinnamon and hypertension? So we should see if they have hypertension or anything before in order to give them cinnamon?
Yes, of course. And cinnamon, these things are anti-inflammatory.
Okay.
And the cause of even hypertension is inflammation.
Right.
Yes. And plus, of course, you have to do some walking, which will dilate your blood vessels, lower your blood pressure. There are other things also, these people, and, you have to develop your circadian rhythm. And most of the time, I give them melatonin. Melatonin is a very, very strong antioxidant. Okay? It is stronger than glutathione. Plus, sometimes, glutathione can precipitate the pathway of cancer. Sometimes some cancers will use glutathione. Okay. Melatonin is anti-cancer. You understand? It treats and it prevents cancer. So I think, and then it develops the circadian rhythm. Means, blood pressure should be higher in the morning when body secretes cortisol. It makes the, blood pressure go high. Nighttime, your body should lower the cortisol production. So your blood pressure, lowers. So it should be like 10 degrees lower at night. Then it means your circadian rhythm is working.
Right.
So that's, I don't know whether it makes sense or
No,
not.
it does. Another thing that I noticed in your practice is that you focus on very specific numbers on HbA1c and the glucose. Let's talk a little bit as far of like when you measure it on the finger, like the pinprick, and then when you measure it on the blood, actually how it is, like HbA1c, and then when we should measure it.
HbA1c, of course, starts every 3 months. They say, it can change every 3 months, but I've seen it changes even a month also, because, all these things I do on myself and see how, because I'm a diabetic also. So I always do it on monthly basis and see if my hemoglobin A1c goes down or no. And that is why, okay, finger stick is a capillary blood. And the blood you take from the vein is a venous blood. So there can be a little difference if you do a finger stick and someday you do blood glucose on your venous blood. There will be a little bit difference, but that doesn't really mean it is a good idea to do your finger sticks or whatever, just to keep an eye that how you are, because you know that what you ate and how much your sugar went up or down or it did not affect. So that means that food you ate and it did not make your sugar go high, you should concentrate on that type of food. And if you ate something and your sugar shot up, you should write down what was it that made your sugar shoot up. You should avoid that food. Okay, so complex vegetables are the answer. complex vegetables. Complex vegetables will not give a high of sugar. So that's great. Mhm.
What is the number that is considered pre-diabetic that they should watch out on the HbA1c?
Okay, the normal level of HbA1c is somewhere between like 4.9 to 5 point maybe 3, maybe 4. Okay, if it is more than 5.4, it means the patient is pre-diabetic.
Mhm.
And if they start taking care of themselves at that point, they will be better off. And I've seen, sorry to, say, the doctors say, oh, you are pre-diabetic. That's okay. No problem. So wait till until you become frank diabetic, and then I will tell you something, okay, what to do. I don't think that's a good idea. A patient is a patient, okay? So we should not assume that, patient knows everything. You can question the patient to see what their knowledge is, and you should tell the patient how to sleep, how to eat. I always start with sleep. Okay, what time you sleep? How many hours you sleep? How is the quality of your sleep? Then in the morning, what do you do? What's your breakfast? What time? What you eat? So I try to modify their own diet.
Mhm.
I do not give them a diet sheet, which may not be, in their culture. You know, I don't know whether they're eating Dunkin' Donuts in the morning and coffee. They might not be.
Right.
So I tell them, okay, what is your regular breakfast? Okay, I eat 2 toasts. Okay, can you decrease it to 1 toast and compensate it with 1 egg, right? So similarly, then what is your lunch? Oh, I eat rice with vegetables, or I eat bread, with vegetables. Then I say, okay, how much rice? Oh, I eat this much rice. I said, okay, make the portion half and increase the portion of your vegetables. Okay, but not potatoes or things which, make your sugars high. Other, like I tell them, cabbage, broccoli, cauliflower, spinach, bell peppers, sweet peppers, whatever, they are colorful. These, rainbow color vegetables are very, very good for your diet, for your body health. So similarly, I ask them, okay, what is your dinner and what time? If they're eating very late, I tell them, no, eat at least 3 hours before you go to bed,
Mhm.
so that your stomach and intestines have already done their digestion part. And now they are, also, while you sleep, they also, do the cleaning of the gut. The bad cells are gotten out, whatever they have to do. And similarly, the brain also. So you have to sleep at least 6 hours the brain needs to detoxify itself.
Right.
So that is why. So that is 10 p.m. one should be sleeping. And a minimum of 7 hours. Now, everybody is different. Somebody needs 7 hours of sleep, some 8 hours, some 9 hours. But more than 9 hours is also not good.
Yeah.
Okay. Yeah.
But uninterrupted sleep, right? Because a lot of people say
Uninterrupted
it's like,
sleep.
yeah,
Uninterrupted sleep. Your cell phone should not be by your side.
right, right.
And, cell phone should be on do not disturb.
And I think it's important to kind of have like a watch or something that tells you, because sometimes you might not know that you even like woke up in the middle of the sleep. And I
Mhm.
think I've been carrying this watch, and I noticed that some nights if I'm tired in the morning, then I see the watch and it shows me that, oh, you didn't sleep as well.
Of
Or
course, this is my watch also.
like,
Okay. Yes.
yeah, I
So
think
the
that's
same
super
thing.
important.
I also look at the watch. What was my sleep like? And believe me, most of the time it tells that the deep sleep was very less,
Mhm.
and light sleep was a lot. Why I'm like this? Because I have a type A personality. So all my life I had sleep issues. So now I do a lot of things. I take calming supplements like L-theanine. I take like 3 times a day. I take melatonin at night. I take, many things. It has made my sleep much better.
Mhm.
So, I mean, this is because I am a very tense type of a person. Even a small thing makes me tense.
Mhm.
Yeah.
I think it's important to be aware because a lot of people say, "Oh, I slept always like this, so it's always going to be like this."
Yeah.
But I think
No,
we take specific habits and do specific things.
habits and try to improve the sleep quality. And I would like them everybody to do a sleep apnea test.
Mhm.
Okay? It's not that obese people have sleep apnea. Thin people also have sleep apnea. And sometimes people cannot sleep properly because they have sleep apnea. So it is, I think, once in a while, at least on a yearly basis or whatever, one should do. And there are home tests. I mean, I cannot do my sleep apnea test going to somebody's office and sleeping there because I have problems sleeping at my own bed. So how can I go and sleep over there? So what I do, I pay and I get the, kit for sleep apnea test and I do it myself.
Right.
So,
Is it something that is from Amazon, or you have to talk to a doctor in
oh,
regards?
no, no, there are doctors, sleep doctors, who send you the kits.
Okay,
And then they, go over your results as well over you. Once you have done,
yeah,
you email them your results, and they will talk about it.
that's
Mm.
interesting because I feel like sleep is one of the most important.
Very important. I don't know. I have never tried Amazon whether it has sleep kits or no. 2 times I did, but it was from some sleep doctors.
Yeah. And it's important on not just fatigue being tired, but actually like on the brain because it cleans up whatever is going on
Exactly.
in
Yes.
the brain.
Yes. And that happens during sleep.
Right.
Yeah. Sleep is the time the brain detoxifies itself. Actually, the whole body, whole body. I told you the intestines also. That is why you should not give intestines the work of digestion
Before.
right before eating before you sleep. Then the intestines will be busy, doing that digestive work. They will not be detoxifying itself. So that's important. And then exercise, sometime, subtype. It all depends. Is very important. One should move around. Even like sitting on a chair after every hour, I think one should get up and just have a round of the house or whatever, so that, that, you have to get up. And plus, do any exercise. I mean, suppose, older people, they can do walking. Younger people do go to the gyms and do sometimes of exercise. But let me tell you one thing. I have seen even my own family, youngsters doing excessive exercise. Excessive exercise is as bad as no exercise. So
Right.
moderation is the key to everything. So one has to be, not doing too much. Sorry, too much exercise is also not good. Yes.
Everyone has to find that moderation that works out with their schedule as well.
Exactly. Exactly. Yes.
That's it.
And I mean, believe me, I can walk like 4 to 5 miles every day easily. Um, I mean, at my this age, I think it is good. I have improved I don't eat junk. Even in my office, people buy food and sometimes on and off they get lunch. I don't eat from. I take my own food.
Yeah. I think
Mm.
your taste also changes when you start to
Yes,
eat healthier because it's the
exactly.
bacteria in the gut that actually doesn't like that food anymore.
Yeah, yeah. And the one thing more important people don't give importance to is their dental health. You know, me- I mean, mouth is a part of your gut.
Right.
So I said that, every disease starts in the gut, means it starts in your mouth as well.
Right.
You know, the flora of your mouth should be very, very normal, not have pathogenic flora of your mouth. That's very important. So, I mean, uh, I mean, I used to get, cavities on and off, on and off. Whenever I go to a dentist, they'll say, you have 2 cavities, you have 3 cavities, I used to pay a lot of money to these dentists. So I do coconut oil pulling. I do oil pulling. Means I have, you can melt the coconut oil, or there is liquid coconut oil also available.
Mhm.
So you can have some, put in, do swishing, swishing, swishing. And I have noticed that I am not getting cavities.
Oh, okay.
Yes. And second thing is that you have to check the pH of your urine. Your pH of the urine should not be acidic, because the blood is not acidic in the body. Our blood pH is like 7.25, 7.4. So, I mean, you cannot keep on checking your blood pH all the time. It is very easy to check your urine. You can dip with that, pH stick, and you know what is it. So it should be like between like 7-ish. If it is 5-ish,
Mhm.
okay, do soda bicarb swishing of your mouth. So your
So
mouth will absorb that soda bicarb, and it will change the acidity
when is the
to,
best time to measure the urine? Like early in the morning?
yeah,
Like,
you can do early in the morning. Yes, of course, because that time it's, urine is, from whatever the night. Yes, the best is to check the early morning urine.
interesting. Another thing that I was kind of interested to hear about you is what do you think of the fasting trend that they do? It's like 24 hours, or they do like the 16 to 8 hours, and the autophagy that happens in the body in that time.
Yes. Okay. Body needs to eat. Its cells need to eat. Okay. And if you are always providing the body with the food, the body will not do autophagy. Autophagy means it is eating up all those bad cells, which are, of course, body keeps on going wear and tear. Those worn and torn cells, body can eat if you are fasting. So fasting is kind of a treatment for many diseases, even cancer. Because cancer has, of course, it's a metabolic disease. It is a mitochondrial dysfunction. So the mitochondria are not in good shape. So all those bad mitochondria are eaten up if you are fasting. Now it depends. You can fast like, 16 hours, 14 hours, whatever increase. I have heard many um, people, they treated their cancers by fasting. If your liver is healthy, right? Your liver stores glycogen. Okay. So if the sugar goes low, the liver throws glucose into the bloodstream. Unless your liver is very compromised, it is cirrhotic or it is whatever it has, and it has not the ability of throwing, I don't think it is an issue. Because I see doctors telling, oh, your sugar was 40, 50. You should, like drink some juice or whatever. No,
Yeah.
I don't believe in that. One thing I've noticed, when I get up in the morning, the first thing I do is check my sugars. Okay, suppose it is 80 or 84. That is my usual range in the morning when I get up. The first thing before I do anything, I check my sugars. I have, like, you will not believe it. I have freestyle Libra on this, I have Dexcom on this, and I have, that also.
Mhm.
Sometimes I keep checking because, I have to give it to my patients, which is the best device, right?
Mhm.
So I always, experiment on myself. So I see Dexcom is giving different reading, Libra is giving different reading. Then I check with this and see which one is correct.
But I feel like you are the best at kind of handling as far as like whatever you give to the patients, you'll do it yourself first.
I
So
do it myself.
yes,
Believe me, I do it myself. Okay. All these supplements which I give to the patients, I have tried on myself. So, so whatever. So when I go to the bathroom, I suppose my sugars, I checked my sugar in the morning, it was 80. I go to the bathroom. After, like, coming out of the bathroom, washing my face or whatever I have to do, I come. My sugars are now 15 points higher. I have not eaten anything.
Right.
So that is why you should be checking before you do anything. Because if you go and come back, your sugars will be higher. Why? Because 85 was kindly on the low side. So when you are in the bathroom, walk, whatever you are doing, the liver thinks, okay, let me throw some sugar, give this person some energy.
Right.
Okay. So when I come, I see my sugars are like 10 points, 15 points higher than what were they when I woke up and checked myself.
Right. And then after we eat, we should check our sugars only 1 hour after?
I think so, because I have seen doctors telling, oh, it's 2 hours, 2 hours. But no, when I tell the patients, no, do 1 hour and do 2 hours, both. Okay, 2 hours will be much lower, 1 hour will be much higher than what it is. So at 2 hours actually should go back to their normal fasting levels. But 1 hour I think you should, this is my opinion. I tell them to check. No, 1 hour. If you want to check 2 hours, check 2 hours, but check 1 hour as well.
Right.
So they will get the idea which one is more important to be checked.
And I feel like once you check with if you have it in your body, it's easier, or rather than the stick, I
No,
feel.
that's okay. That's okay. Do it with whichever you like. Okay.
Right.
And at least have something to measure and something to give you idea.
Right.
Yeah. And if you think that no, you can on and off, recheck with your finger sticks.
So for right now, it's the November awareness for the diabetes. What are the final thoughts that you think everyone should know, and actionable steps in regards to this? One actionable step, because I know we went through a lot.
Yes, I would say that everybody should do some type of good sleep, exercise, and eat complex carbohydrates with some protein and fats, whatever. But that's what it is.
Right.
Diabetes Awareness Month means we should make the people aware of this thing.
Thank you. I appreciate all your time today, and that's all the time for today, but I'm looking forward to the next episode.
Yes, it's so nice to have you.
Thank you. Thank you so much for being part of today's episode with Dr. Sajjad. I hope this conversation has offered you a fresh perspective on how interconnected our health truly is, and how managing conditions like PCOS, diabetes, and metabolic syndrome requires an approach that looks at the body as a complete system. Dr. Sajjad's insights on the role of sleep, diet, exercise, and specific supplements are a reminder of how small, mindful changes can significantly impact our health. As always, please remember that these insights come from Dr. Sajjad's experience and expertise. They are intended to provide guidance and knowledge, but they don't replace personalized medical advice. It's essential to consult your healthcare provider before making any significant changes to your health routine, as each person's journey is unique. If you enjoyed this episode, don't forget to subscribe to Neurona QL on YouTube and Spotify. Join me on this journey as we continue exploring the science of the mind, the power of the body, and how seeing ourselves as a complete whole can lead to a life of purpose, resilience, and fulfillment. Thank you for watching, and I look forward to seeing you in the next episode.